All right. Fantastic. All right, so thank you everybody for joining us. I really appreciate you taking the time out this evening to come. So I'm Erin, I'm the Access Team Project Manager. I know a lot of you have already gotten emails from me. I saw that several of you heard about this from an email, which is fantastic. But for those of you who are just now joining us, I'm so excited to have you. I just joined NARAL, Pro-Choice Maryland, a little over a month ago, so I'm excited that Diana is also on here. Diana is our ED, our Executive Director. So I invite her to chime in as well if there's any moments, if there's any additional information to add, anything like that. So tonight we're just going to be talking through our Access Team initiative, kind of what we envision for it, the type of work that we see our Access teams doing, and also how you can get involved in the Access teams. So I'm going to give space at the end of each slide for folks to ask questions, and you're welcome to either put it into the chat or to say it out loud, depending on how you feel about that. And I'll do my best to check the chat pretty regularly for questions, but Diana, if you see any that I haven't noticed, definitely feel free to shout them out as well.
Okay.
All right. Oh. Okay. So what exactly is an access team? So access teams are groups of people who are working to improve access to sexual and reproductive health care, rights, and freedom in their area. So it could be an existing group that is already doing work around sexual and reproductive health care, rights, or freedom, or it could be a new group of volunteers who we bring together who are interested in doing that work in their community. So our access teams are going to be our points of contact on the ground, folks who can raise local issues that we may not have heard about, folks that we can go to if we need assistance or if we need feedback on a project, and just people who we can, mobilize when we need to get stuff done. It's a great opportunity to be an advocate for others in your community, to meet other folks in your area who are really interested in this work, and also to get some hands-on experience in reproductive freedom and justice. So right now, our focus is on recruiting volunteers. This is a brand new initiative. We just got it started last month. So right now, this is kind of the build-up time. We're trying to get more folks on board. So we're recruiting all over the state. And we envision that we'll get our access teams started kind of initially by county, but that as they grow and as we see more folks, we may have them by city or have them in smaller units, just based on how many people are interested. And we do think we're probably going to get our first access team started relatively soon, either the end of this month or early next month. And right now it looks like Montgomery County and Baltimore City are the folks that we're seeing the most of. So that's probably where we'll get started, but we're really hoping to get access teams across the state within the next year. So even if there isn't one started right now, we're going to get them started pretty soon. So our access teams, we're going to be doing regular check-ins with them to make sure that you all have all the resources you need, that you can flag any local issues for us, and that you can, raise any questions that you're seeing popping up in your area. We're also going to be offering you trainings and opportunities to meet with the other access teams, both across the state and regionally, so that folks can collaborate and can talk about the work that they're doing. We're basically looking for folks who are there to take action, to be our boots on the ground, to listen for us for any issues that we might not be aware of. All right, do folks have any questions from this slide? And I'm realizing I can't see the chat. So Diana, if you see any questions popping up in the chat, let me know.
Will do.
All right. So now I'm going to move on to talk about our 8-issue campaign. So this is, these are kind of the ways that we organize a lot of the work of our foundation. And these are the ways we're going to see kind of to plug in our access teams. So our first campaign is to address the deceptive advertising and practices of anti-choice crisis pregnancy centers. So crisis pregnancy centers are storefronts that provide information and services for individuals who either suspect or know that they're pregnant. And these services are generally free pregnancy tests and counseling on abortion, but they also, in some places, may include STI testing, religiously based parenting advice, as well as other services. So if you've ever seen a billboard or even a wheat paste ad that says something like, pregnant, need help with a phone number, that's probably a crisis pregnancy center. There's a hotline that is 24 hours that redirects people who call in to the closest crisis pregnancy center, and often the phone number is for that hotline. So, despite the fact they provide these free services, and that sounds fantastic, really their end goal is to discourage people from seeking abortion. And they do this by giving you misinformation about both the safety and efficacy of abortion, as well as often the safety and efficacy of birth control methods. So there are 46 crisis pregnancy centers around Maryland right now. And there's only 21 abortion providers. So there are more crisis pregnancy centers than there are abortion providers in Maryland. Thankfully, we do have 70 Title X funded family planning clinics, which can help to provide low cost or free birth control options for folks. So at least there are additional options available to them. So we're in a better place than some states are in that way. And unfortunately, a lot of these anti-choice crisis pregnancy centers do place themselves either near a university, in a low-income area, or near a legitimate clinic. And the purpose of that is to either basically be the only option for folks in that community when it comes to family planning, or to try and redirect folks who are trying to go to either a legitimate medical appointment or to an abortion appointment into the crisis pregnancy center. And sometimes they wind up making people miss abortion appointments or appointments at a Title X family planning clinic. We did a investigative report in 2018 looking at crisis pregnancy centers around the state. And what we found is that a lot of them are collecting personal information about people using an intake form that looks similar to what you would get if you went to your doctor's office, but they're not held to HIPAA in the same way that legitimate medical facilities are. And so they're collecting this personal information, but they're not held to any accountability around where that information is going. And really, they can use it in any way that they choose to. They may also lie about the medical credentials of their staff. So for example, there might be a diploma on the wall from a doctor, but that doctor's only there 1 day a week. And so the person you're talking to is not the person whose medical credentials you're seeing. You also will see folks using medical terminology in an effort to look like they're a legitimate medical clinic. Additionally, almost all of the crisis pregnancy centers that were surveyed in this investigative report were overtly religious, whether that was having, Bible quotes on the wall, giving out, overtly religious materials, offering to pray with people when they're counseling them, using religiously biased parenting classes. The fact that most of these are religious institutions was evident for folks once they went to the actual crisis pregnancy center. They also give misleading information about the efficacy of birth control methods. They may say that they're not effective at all, or may very much overestimate how likely you are to get pregnant on those methods. Often the purpose of that is just to funnel people into the idea that abstinence is really the only safe option. And then they also overstate the physical and mental health risks of abortion. So for example, they may say that 2 in 3 people who have an abortion will attempt suicide within the next several years. That's something I've seen several crisis pregnancy centers say, both in Maryland and in other states. And they may also overstate, its risk to your fertility or the likelihood of breast cancer in the future. And really, in the end, the whole point of it is to try and talk you out of abortion as even an option. So this is really concerning because it can cause people to make choices about their lives and about their pregnancies that they wouldn't have otherwise chosen to make. May cause them to feel guilt or shame about the choice that they make, or may cause them to miss an abortion appointment and therefore have to reschedule, which can be costly and can also cause the procedure to become more time consuming. So you can see why this is something we worry about. Goals of this campaign are to decrease their deception, try and create policy so that they're not able to be as deceptive as they are, to identify the scope of the problem to make sure that we know about all the crisis pregnancy centers across the state and how many people they're affecting, and also to increase awareness around Maryland about how you can identify crisis pregnancy centers so that less people wind up there when they're trying to go to a legitimate medical appointment. So some example actions that we see our access teams taking on this campaign are to create an education campaign about local crisis pregnancy centers or about how you can spot a crisis pregnancy center, and to advocate for community agencies to stop referring people to crisis pregnancy centers for healthcare, which unfortunately is something that does happen, whether knowingly or not. All right, does anybody have any questions about this campaign? All right. And don't worry, there's plenty of time to ask questions as well. So even if you don't think of one now, you're always welcome to ask at the end or on another slide. All right, so our next campaign is improving sexual and reproductive health care in schools. So right now, about half of Maryland school districts have school-based health centers, which provide healthcare both to students and sometimes to other people in the community. And 9 of those school districts have school-based health centers in high schools. So these school-based health centers are a really great opportunity to be able to provide comprehensive sexual and reproductive health care in schools and to reach youth who might not otherwise be able to access that health care. Despite that, only the school-based health centers in Baltimore City and Dorchester County actually offer comprehensive sexual and reproductive health care options. Some of the other ones may offer some options. For example, they may be able to provide STI testing, but not birth control. So we would love to see more comprehensive sexual and reproductive health care happening in schools. So the Youth Risk Behavior Survey found that 22.1% of Maryland high school students reported having sex in the past 3 months, with 15.8% of those not using any birth control method, and 43.1% not using a condom. So we do know that youth are having sex and are at risk for pregnancy and STIs. Additionally, the YRBS found that 12.8% of Maryland students identified as LGBTQ, and that this was correlated with a higher chance of having had sex. 30.9% of LGBTQ youth in the survey were sexually active. And it was also correlated with people not using a birth control method. So 32.9% of LGBTQ youth in the survey did not use any birth control method the last time they had sex. And although we know that some of those sexual encounters don't pose any risk of pregnancy, the risk of STIs is still there. And in some of those cases, the risk of pregnancies is still there. And this disparity might reflect a lack of information about safer sex for LGBTQ plus students, as well as a lack of inclusivity in the sex ed curricula. And we're currently working to learn more about the sex ed curricula around Maryland. So we're hoping to, continue to work on this. Additionally, every year from 2014 to 2018, about 800 youth from age 15 to 17 gave birth in Maryland, and about 2,200 youth aged 18 or 19 gave birth in Maryland. So that's a lot of folks who are either in school or recently graduated who are pregnant, expectant, or parenting. And we do have concerns about pregnant, expectant, and parenting students being forced out of their home schools and being forced into a different school, sometimes which may not be of the same quality, being penalized for missing school due to pregnancy or parenting related issues, or not being given the accommodations that they need to stay in school. So these are things that we're looking at and working on right now. Some goals of this campaign are to improve and expand sexual and reproductive health care in school-based health centers, to improve the sex ed curricula in Maryland, and to protect the rights of pregnant, expectant, and parenting students in this state, to make sure that they have the same access to quality education as every other student in this state does. So some things that we could see our access teams doing on this count are monitoring local school board meetings for discussions about sexual and reproductive health care. So for example, if they're talking about the sex ed curricula, having somebody who can attend that meeting and report back to us on what was discussed would be so helpful. And encouraging local schools to carry free pads and tampons for menstruating students, because we know that unfortunately these products are expensive and not every student is able to afford them. We want to make sure that students feel safe and comfortable in school. So does anybody have any questions about this campaign? All right.
And if you do have a question, if you do have a question, go ahead and just say something in chat and I can unmute you, or you can unmute yourself, because there's a small enough group that I don't think that we're going to drive each other crazy. So
yeah, that makes sense. Sounds good. Thanks, Diana. All right. So our next campaign is improving sexual and reproductive health care and rights on college campuses. So, you know, most college campuses do have an on-campus health center. However, not all of them are able to offer birth control. Some offer limited options, some offer no options. Sometimes this is tied to, you know, the school being religiously based. And additionally, many of those on-campus health centers have limited hours that either are, you know, only a couple of days a week or that reflect traditional business hours. And this is a challenge when it comes to emergency contraceptive. So, you know, students who need access to emergency contraceptive might need that on the weekends, and we know that it has more effectiveness if you take it earlier. So it's pretty concerning that somebody, for example, might have unprotected sex on a Friday, but not be able to access emergency contraceptive through their school until a Monday. And we would love to see people accessing it sooner. Additionally, students face barriers in getting to pharmacies or family planning clinics that provide birth control options or emergency contraceptive because, for example, they might not have transportation, as many schools don't allow students to have cars on campus, or they may not be able to afford those services because, unfortunately, emergency contraceptive over the counter at the pharmacy is often $40 or $50, and for students that may be an insurmountable amount of money. We also have some concerns about accurate reporting around sexual assault, making sure that survivors feel safe reporting sexual assault on their campus, and a lack of support for LGBTQ plus students, as well as pregnant, expectant, and parenting students on college campuses. So some goals of this campaign are to improve and expand the range of sexual and reproductive health care options in the college wellness centers, to support student organizing efforts around better access to emergency contraceptive, or about expanding the range of sexual and reproductive health care options on their campus, and to help colleges become more inclusive towards the needs of students who are LGBTQ+, pregnant, expectant parenting, or who are survivors of sexual assault. So some ways that we can see our access teams getting involved are working with students to increase access to emergency contraceptives, and to fighting for free access to menstrual supplies on college campuses because college students have the same issues with access that students in K through 12 schools do. And we are working to build access teams on college campuses, but we could also see, you know, the need for community members to, you know, step in and be mentors or guides to those students. So we'd love to get people involved in that way as well. Does anyone have any questions about this campaign? All right. So our next campaign is Parenting with Dignity and in Economic Security. So as you all know, the US's paid leave policies lag far behind the rest of the world. 145 countries currently guarantee workers paid sick leave, and over 120 provide paid maternity leave, and the US has neither of these. Right now, only 17% of workers in the US have access to paid parental leave. So that's a pretty small percentage compared to a lot of other countries. While the US does guarantee 12 weeks of unpaid leave to people who meet certain stipulations, those stipulations don't cover, you know, a vast swath of people. For example, you know, small businesses are often exempt, or people who've not been working for a company for very long. Maryland also requires all employers to give their employees 6 work weeks of unpaid time off over the first year after the birth or adoption of their child, but this law comes with similar stipulations that mean that some people don't have access to it. And as we know, unpaid leave is not accessible to everyone, right? If you're already living paycheck to paycheck, you're then faced with the choice of, do I keep a roof over my head, or do I give myself the time that I need to recover from childbirth potentially, to bond with a new child, and to be able to access the health care that I need for myself and for my child. The Family Medical Leave Act requires employers with 50 or more employees to provide unpaid leave for serious health conditions or illnesses for employees who work there for at least 1 year. But that means that anybody who hasn't worked there for at least 1 year is not entitled to any protection. And considering that we're currently in a pandemic, that is especially concerning because that means there's a lot of folks who have a choice between, do I keep my job and go into work sick, or do I potentially lose my job and keep the people I work with safe? Paid leave is also really important when you think about abortion care, because many people, many clinics provide abortions in the morning. And so if somebody works in the morning, they may not be able to access it. And it's also extremely important once you think about later abortion care, because once you're into the second trimester, it's often a multi-day appointment. And then someone would need to be able to take, 2 to 3 days off of work to be able to access the healthcare that they needed. Currently, the federal minimum wage is $7.25 an hour. And that means that somebody who was working 40 hours a week for 52 weeks would make only $15,000 annually. And as we all know, that is not enough for a family to live off of. Maryland was the 6th state to require a $15 minimum wage for workers, which we're currently working our way up to, and we'll get there in 2025. But MIT analyzed an actual living wage per state, and they found that for a family with one parent and one child, someone would need to be making $29 an hour to be making a living wage. So it's almost double what the eventual minimum wage will be. And of course, these issues disproportionately impact low-wage workers, workers of color, and undocumented workers. And it's really important that folks have access to the accommodations that they need to allow them to maintain a healthy pregnancy and to parent in the way that they would choose to and have the time with their family that they would like to. So some goals of this campaign are to allow all pregnant workers the right to reasonable accommodations to maintain a healthy pregnancy. For example, if somebody works at a cash register and they're standing all day, they might need some extra break time built in, or they might need to have a chair set up for them so that they can sit down during their shift. Also, to support passage of a state paid medical and family leave law, and to create protections and accommodations for the right to express breast milk at the workplace, and to make sure that people have a safe space in which to do so. So some examples of actions that our access teams can take around this campaign are advocating for state and local policies to require fair scheduling practices so that parents know ahead of time what days they're going to have off so they can schedule healthcare appointments for themselves and for their children. And to identify any local employers who are not treating pregnant, expectant, or parenting employees equally. All right, do we have any questions about this campaign? All right. Our next campaign is advocating for those in the care, custody, and control of the state. So NARAL, Pro-Choice Maryland, convened a coalition called Reproductive Justice Inside, which does work around access to sexual and reproductive health care and rights for system-involved women and girls. And they do some really fantastic work. I would really encourage you to check out their website, which you can find through our website or just Googling Reproductive Justice Inside. But some things to know kind of about the state of reproductive health care and of incarceration in the state. So Maryland has an incarceration rate of 585 per 100,000 people, meaning that we lock up a higher percentage of our people than most high-income countries do, which unfortunately is the same across most of the US. And just like many of the other things we've talked about, disproportionately impacts people of color and especially Black folks. So Black folks make up 68% of the incarcerated population, despite being only 29% of Maryland's total population. As of 2015, there were 1,000 women in county jails, and as of 2017, there were 833 women in our prisons. Over the last 10 years, there's been an 800% increase in the number of women incarcerated in the US. So this means that a lot of county jails and prisons are having to deal with new healthcare challenges and issues that they had not had to encounter before, and having to figure out policies around how to manage sexual and reproductive healthcare for people who are involved in the system. Girls make up 17% of the juvenile offender population in Maryland, and just like with adults, Black girls are more heavily impacted by this. They are 5 times more likely to wind up in the juvenile justice system than white girls. And these women and girls still deserve equal access to all of the sexual and reproductive health care and rights that everyone else has. Additionally, about 4% of women entering prison are pregnant upon intake, and so they need access to prenatal care and safe delivery options if they choose to continue their pregnancy, or to be able to access abortion if that's what they choose for themselves. So some goals of this campaign are to increase access to timely and quality sexual and reproductive health care for system-involved women and girls. So we want them to know what their options are. We want them to know how to access those options. We want to make sure that they're receiving equal access to those options as anyone else would. and also to help those who are coming into the system or leaving the system to gain access to needed sexual and reproductive health care and rights. So as women and girls exit the system, we want to make sure that they get connected to community services and have, you know, continuity of care. So some things that we see our access teams doing on this campaign are serving as liaisons for women and girls in the care, custody, or control of the state in their local facilities, and helping to support the right for a new parent who is in the system to express milk and to coordinate ways for the milk to be routinely transported to those caring for the baby if the parent does choose to breastfeed. All right, does anyone have any questions about this campaign? Okay. Our next campaign is improving maternal health outcomes. So, as you probably know, the US maternal mortality rate is higher than in comparable countries at 31.2 deaths per 100,000 live births. And unfortunately, Maryland is even higher than the US on average at 53.4 deaths per 100,000 births. And non-Hispanic Black women are 2.4 times more likely to die during childbirth than white women are. So again, Black women are disproportionately impacted by this. In Maryland in 2016, Black women accounted for 78% of deaths directly due to pregnancy. And additionally, 1 in 7 women experience depression during pregnancy or in the first 12 months after delivery, but only 50% of those people actually receive a diagnosis. So there's so many people who are walking around dealing with mental health effects, but without access to care and without a diagnosis. So some goals of this campaign are to advocate for hospitals to eliminate reproductive coercion practices and policies barring the provision of the full spectrum of maternal health care. So for example, some hospitals won't perform tubal ligation and, you know, won't sterilize women after birth, even though that's often one of the safest and least expensive times to do so. We want to make sure that people know that ahead of time and have access to the maternal health care that they want. Also, to protect the rights of pregnant people who are seeking mental health and substance use disorder treatment without criminal justice intervention. So people need to know that if they're going into treatment, that they can do so safely without worrying about potential involvement from CPS or the criminal justice system. So some example actions that our access teams might take here are identifying ways for more community members to have access to doulas to help improve maternal health outcomes. So trying to get people connected to doulas in their community who can advocate for them both during pregnancy, during delivery, and afterwards, as well as promoting required intensive diversity and racial bias training for healthcare workers, since it's clear that this disparity is driven, at least in part, by bias on the part of healthcare workers. Any questions about this campaign? All right. Our next campaign is increasing access to contraception. So we've already talked a lot about access to emergency contraceptive and why that's challenging, but it's really important to know that using birth control is really not a controversial subject, right? So 99% of sexually active women use birth control at some point in their lives. So that is the vast majority of women who access contraceptives at some point. Thankfully, the Affordable Care Act requires employers and university-provided health insurance to cover preventative care for women, and that means that they're required to cover birth control. And that has helped to save women an estimated $483 million per year. So that's a massive savings to people. Unfortunately, though, employers who want to deny their employees coverage of contraception won the right to do so through Burwell versus Hobby Lobby. And some states have also enacted laws that allow individuals and companies to refuse to provide or to cover contraceptives. Most recently, in July, the Supreme Court ruled in Trump versus Pennsylvania that the Trump administration has the authority to create an exemption to the mandate so that all or most employers can opt out of providing contraceptive coverage to their employees for religious or moral reasons. And this is a huge problem because hormonal birth control pills, which are one of the most popular options, can cost up to $600 per year without health insurance. And for a lot of people, that's just not something they can afford to do. Thankfully, Maryland law has required health insurance plans that cover prescription medication to also cover birth control, any birth control that is approved by the FDA. And Maryland prohibits copays for birth control. and mandates insurance coverage for up to 12-month supplies of contraceptives. So we have really great coverage here. But we do also have an exemption for religious organizations that are opposed to providing contraceptives, so they do not have to do so. And then, like I said, once you start thinking about emergency contraceptive, there's some extra hurdles as well. So in 2017, we did some research about access to emergency contraceptive around the state, looking at pharmacies and stores where it's provided. And we found that 35.7% of stores added unnecessary age requirements. 46.6% kept it behind the pharmacy counter or behind the cashier. And 36.7% used anti-theft devices to protect their emergency contraceptive. So all this means that someone has to talk to a worker in that store to be able to access emergency contraceptive, despite the fact that it is an over-the-counter medication. And that can be an additional barrier for folks who just don't feel comfortable having to talk to someone about accessing it. And it's just something that people don't have to do for the vast majority of over-the-counter medication. So there's not really a great reason for it to be treated differently. So some goals for this campaign are to promote public awareness about the existence and safety of over-the-counter and prescription emergency contraceptive. So people need to know that it's something safe and that it's easy to access, or at least as easy as we can make it. And also to advance access to hormonal birth control options in non-clinic settings. So we do have a law that pharmacists can receive a training so that they're able to provide birth control without a prescription from a doctor. But unfortunately, a lot of pharmacists just haven't taken that training. So one of the example actions that folks could take on this campaign are to encourage their local pharmacists to take that training so that they can provide hormonal birth control to people, because that increases access significantly when you think about the number of family planning clinics as compared to the number of pharmacies across the state. If everyone could access birth control at their pharmacy, it would make things a lot easier for them. And another action would be to advocate for better access to emergency contraceptives in pharmacies and stores, to make sure that ideally it's not behind a counter, it's not behind an anti-theft device, that it's really easy for folks to find. And then if they're not willing to do that, to at least have a sign or something pointing folks to where it is so they're not hunting around for it. All right, any questions about this one? All right, so our final campaign is protecting and advancing access to abortion care. So we're in a relatively lucky place here in Maryland in that we don't have any targeted regulation of abortion provider or TRAP laws, such as requiring for any abortion clinic to be a surgical center. We also don't have any waiting periods, and we don't have any unnecessary ultrasound requirements. So we're very lucky in that regard. We're also one of 16 states that allow our Medicaid funds to cover abortion care when it's deemed medically necessary. And we do have access to later abortion care, both in Bethesda and in DC. So we have folks traveling from all over the country to access abortion here in this area, because the only other two states that have later abortion care are New Mexico and Colorado. So really we're serving a huge swath of the country in this area. We codified Roe in 1992 by legislation and ballot referendum, so that if Roe is struck down, which I know is something a lot of folks are thinking about now, we would maintain the level of access that we have now, which is fantastic. However, we do require that only physicians can perform surgical or procedural abortions, despite the fact that it's globally recognized that advanced medical practitioners like nurse practitioners can safely provide abortion. But thankfully, our AG, our Attorney General Brian Frosh, did release an opinion in January saying that physician assistants, certified nurse midwives, and nurse practitioners can provide medication abortion care, which is fantastic. Many states do have parental notification laws, and we are one of those. However, we are different from those other states in that minors who are having an abortion or seeking an abortion can get bypassed from their position. So if their doctor deems that it would be that either the minor is mature enough, or it's in their best interest for their parents not to be involved, or that notification may lead to abuse, they can bypass that notification requirement, whereas most states require you to go before a judge to bypass that requirement. And we have a 2-to-1 pro-choice majority in the Maryland General Assembly. We're hoping to keep it that way. But despite all of that, unfortunately, in 2019, 16 anti-choice bills were introduced into the General Assembly, we were able to defeat all of those, and we hope to keep it that way. All right, so some goals of this campaign are to assist with public awareness about the existence and safety of medication abortion. As you know, as we've seen recently, people are still questioning the safety and efficacy of it, even though it's been around for 20 years and has been shown time and time again to be very safe. And to develop a patient navigation network to support Marylanders and those traveling to Maryland for abortions with transportation, lodging, childcare, and translation or interpretation services. So some example actions we see our access teams taking on this campaign are monitoring local government meetings where measures about policy and budget might affect abortion care access. So if somebody's trying to introduce a policy that might make it challenging for an abortion provider to continue operating. And then also volunteering to drive people to their abortion appointments, to support them at that appointment, or to offer them space within your home if you have a spare room or a couch that somebody who's coming in from out of state could sleep on. All right. Do we have any questions about that campaign? Okay. So, like I said, right now, really what we're focused on is recruiting our volunteers. So that's the main focus for the rest of this month, though we're hoping to move on to forming those groups relatively soon. But as an organization right now, we're really focused on voter registration and getting out the vote. And we would love for you all to get started doing that if you haven't already. So there's tons of ways that you can help out with voter registration and getting out the vote. You could be a voting captain with Turnout Nation and help get your friends to go and vote. You can serve as an election worker in your county. You can volunteer with Baltimore Votes, who's doing some in-person voter registration over the next couple of weeks. You can volunteer with Headcount to help register people to vote at local events. They have events kind of all around the state that you can volunteer at. You can become a volunteer with your local League of Women Voters if you identify as a woman and help with events. So tons of ways to help get out the vote. This is something we're super focused on right now. If you're already volunteering, awesome. If not, we really encourage you to get involved. And then next steps as far as the access teams go. Volunteer sign-up sheet to everybody who registered for this call, and just ask you to fill that out if you're interested in joining an access team, and that'll add you onto our listserv to be updated as we're starting to hold initial meetings and as we're starting to hold our trainings. And we'll also send out some volunteer opportunities around voter registration, get out the vote, and potentially around reproductive rights and freedom in the future. Also, if you have any friends in your area who you think might be interested, who are pro-choice, or people who are really excited about doing reproductive health care work, definitely send them the volunteer sign-up sheet as well. The more folks that we get in your area, the quicker we can get an access team going. And start familiarizing yourself with the sexual and reproductive health and rights landscape in your area. So where are folks going to access care? Who are the folks that make decisions about sexual and reproductive health care in your community, in your schools, in your healthcare centers? Just getting a sense of what it looks like in your community. And finally, keep an eye out for any emails with training and volunteer opportunities. Like I said before, we're going to provide training before we get any of the access teams really started taking action. But we will be sending out information about that relatively soon. All right. Does anybody have any questions for me?
I have a question.
Yeah.
As you start to get these teams of volunteers together, do you think that you would be able to meet like one-on-one or a couple people chatting together to see, to kind of assess our experience, like to look at me, look at my background, help me figure out how I can help, because I know which area I'm most interested in helping out, but maybe you would want to steer me toward a different place or with a different group of people to work with. I think working not alone, but with other people would be nice.
Yeah.
So, I mean, I can tell you that the clinics, the pregnancy centers, ever since I learned about them a few years ago from Diana, has been very maddening. I always get mad just thinking about it. All of your areas of focus sound really well thought out and really, I don't see one, more important than another, but those crisis centers always makes me mad. And, but as far as helping, I still would want a little one-on-one with how you see me helping.
Yeah,
If
I would
that
be
makes
happy.
sense.
Yeah,
Okay.
yeah, I would be happy to do a call, or we could do a Zoom meeting and talk about that. Yeah, I'm happy to chat with
I
you.
do think, yeah, yeah, okay. And the policy work, I think, is important. I don't know if I have the knowledge or ability to help with that, but um, my son, his wife just had a baby a week ago who is a preemie, 7 weeks
Aw.
early. So he's in the NICU and doing okay. But, they fit into what you're talking about.
Yeah.
She doesn't work at this point because she had a high-risk pregnancy. He has to take off of work, and he hasn't been at his job a year
Ugh.
because they moved here a year ago and he got the job. So he's having to take leave without pay for several months. And because it's COVID, my husband and I are the only allowable babysitters for the 20-month-old older child.
Oh, oh
So
gosh.
it's a very happy time. And yet, because of COVID, it's a difficult time, more
Yeah,
difficult. So
absolutely.
I don't mean to take up time with that, but the policy, I'd like to see family leave improve.
Yeah, I completely agree.
He's allowed to take off a couple of months by state law without pay. So he is taking leave without pay.
Yeah,
So,
yeah, it's definitely frustrating, and that's definitely an area that we're working on. Um,
and
and
of
we,
course, they're in a better position than some of the people you're talking about. So
yeah,
thankfully, that is, there should be more help to the people that you brought up.
yeah, and we would love to see everybody to have access to that. That's the goal, is for everyone to have equal access to paid leave. But that's fantastic. Yeah, I will. If you send me an email, we can set up a time to chat and talk about, what you'd like to work on, and I'd love to get
Okay.
you involved.
Yeah, and Elaine,
Okay.
those are the kinds of stories that we're collecting in order to try to argue for that bill. So,
Okay.
Yeah.
Great. All right. I'll mute now.
All right. Any other questions? Okay. Well, if not, my email is up on this slide. Whoops. And then of course it went away. So feel free to send me an email with any questions that you have. And like I said, I'll be sending out an email to everybody who is registered for this call tomorrow with the volunteer sign-up sheet and some more information about ways you can volunteer with voter registration and get out the vote efforts. But definitely feel free to shoot me an email at any point. And my email is also on that volunteer sign-up sheet. So even if you forget it, you'll still have access to it. But if we don't have any other questions, I'm going to go ahead and end the call. And I hope I'll see you all again soon at a volunteer meeting.
thanks, folks. Thank you for joining us. Really appreciate it. We look forward to working with you.
All right. Thanks, everybody. Diana, I think